guys, welcome to Untitled and today I am here to talk about a very most relatable topic for all the MBBS and MD students. The topic is how to fall in love with community medicine. Generally, most of the students find the subject is very vast and difficult, and sometimes even question its existence. But let me tell you, this subject is very essential, very vital and cannot be skipped. Because most of the people find it difficult, maybe because this subject make you to use common sense, and which is missing these days. But these subjects give you a perspective from a patient's perspective, a family perspective, rather than just a perspective of a doctor. This subject makes you to think from a perspective of a community rather than just a hospital. Because later on, when you guys will be going up in the hierarchy, you will be taking decisions for the community, for the people. Because you'll be formulating guidelines, health program, policies. For that, you must have an understanding of the community, how the society works, what is the common human behavior, what are the common norms in the society which is being followed, what is the hierarchy. This subject gives you in-depth understanding of that. In this subject, you are not dealing with only the physical dimension of the health. You are going to deal with psychosocial, spiritual, financial and other dimensions of the health. And with this subject, you will need a rational thinking. So, today I am here to give you some tips of how to fall in love with this subject. And as usual, this subject have two aspects, practical part and theory. And generally I always advise to give more focus toward the practical aspect of the subject, because that is very important. For practical, I have total 6 tips for you. So the tip number 1 is you have to travel to the field, you have to communicate with the people. These things you have to get used to. Because when you go to the field and you communicate with the people, you get a first-hand knowledge. You get to know the ground reality, how the programs are being implemented, what all the facilities or who all are the beneficiaries of those schemes, program, and what all problems people are facing. Then you need to have an out-of-box thinking and to come out with some solution for them. Also in this subject, you will improve your communication skill and presentation skill. These skills not only help you to grow individually but also in your career. Then the next tip is you have to relate each and everything to the health. Like for example, like if you are reading a newspaper, then if there is some news about government decision, then try to think that how this decision of the government will change people's behavior, how it will affect human health. Like for example, if you went outside to a tourist place or to a factory, then see how the people are surviving there, what are the socio-economic status, how their behavior is affecting their health, what all environmental hazards or exposures are there which will affect the human health. So all those learnings are always there. The only thing is you need to look at those learnings. If you really see anything under the sky or sun can be related toward the human health. Wherever human is presented, public health or community medicine will be there. To make it more interesting, what you can do is you can watch some public health movies or even TV series like your Chernobyl, Contagion, Nipah, Sicko. There are a lot of movies. Then the next step is that before reading any health program, what you do is you think from this perspective, like you're a health minister or you are the in charge of a community where you have to deliver services. Then think what all manpower will you use, how will you use the resources, the available funds for you, and try to chalk out a plan. And then go and read a textbook or look at the program website, what all things the program or initiative program have taken. Then try to look at how far your understanding or your innovative ideas are matching with the current guidelines. And if you come out with something new or some discrepancies there, definitely go and discuss with your friends, with your teachers or the people who are related to it. To have a better understanding of a program, you can also go visit a primary health center or any government hospital. Go and meet people, the beneficiaries of those programs, and then see how the programs are running and what all benefits people are actually getting it. Then the next step is always be curious about 5 W's: who, when, where, what and why, and if possible how. Because all these things makes you an epidemiologist, because you will be dealing with the problems. And in epidemiology, you have to deal with research and numbers. Do not get scared with numbers and try to be comfortable with them, because every number will have a story to tell, that why that number exists, why this number is high or low, what can be done to change this number. And when you are good with epidemiology, then only you can help your patients or the people or the community. Then the next important thing is that you have to get involved in research, at least get a basic understanding. Like ICMR gives an opportunity during MBBS, like getting enrolled in STS projects, or if those facilities are not there in your institute, then try to get involved with NGOs or any companies and or any other organizations, and try to do a small study, even a small cross-sectional study or a record-based study, which will give you a basic understanding of research, how it is done. And so later on you should be able to look at the research paper and should be able to critically analyze them, and should be able to take a decision, okay, this is good research, this is bad research, and based on this I'll take this decision. And another reason to get involved with research is that you are not only a doctor, you are a researcher too. Because as a doctor you have to deal with the latest scientific evidences. You should be able to grade them, you should be able to critically analyze them. You should try to have a hands-on training on research. That is the important thing. Then the next tip is that you have to show a little bit of interest and try to find out a teacher who is interested in teaching. Let me remind you, not all the good, intelligent people are great teachers, because teaching is a very difficult and a very different art. That's why the people undergo through different courses like B.Ed and other teaching courses. So you have to find out a teacher who is interested, who do not teach you more about toilets and mosquitoes, because that will make it very boring to you. The subject has very interesting topics, like something like your epidemiology, researches, like your health economics, social sciences, tribal health, urban health. There are various topics which are very, very interesting to know about it. Try to read about those topics and discuss that. Now coming toward the theory part, or you need a textbook which can help you to understand this subject very easily, because your eyes cannot see what your mind does not know. So at this point I would like to review a textbook which have been sent to me by Walters Kluwer. So this is a textbook of community medicine written by Dr. Rajiv Bhalwar. In this textbook, almost 21 authors have contributed. Those authors are from AIIMS Nagpur and your FMC. About this textbook, I like the three things. The first thing is that it is written in very easy and simple English language, which makes it very easy to understand and which is very crisp without diluting the important content of the topic. In medical colleges, most of the students come from various different backgrounds and they may have a different level of command over the English language. Then the second thing which I liked about this textbook is that this is highly updated to the latest guidelines and health programs, and it has the new topics like COVID pandemic management, your tribal health, urban health. It is based on competency-based medical education, and it has your research, biostatistics, which are very essential to have an in-depth understanding. And the third thing which I liked about this book is that it has MCQs for your competitive exams, for which will help you to crack those entrance exams, and it has the theory part. The chapters are given under subjects, under subheadings, which makes it very easy to understand a topic. And if that heading or if that topic come for your theory exam, you can easily write from it. And so overall, I like the textbook. If you guys are using this textbook, then do write about it in the comment section. And in the comment section, also mention what all things do you like about community medicine and what all things you do not like. So I would be happy to read all those comments. So see you guys in the next video. Tata, bye bye.